Okay, this beautiful patient came in concerned with her under eye hollowing. Now, she is one that has, if you really look at her close, she has that kind of pink hue under her eye. And so I let her know that that was going to need to be strengthened by dermal strengthening. So when we talk about that, I'm talking about PRP, microneedling, lasers, anything to really thicken that skin. It is the thinnest skin on our bodies, and so seeing how thin that she is already, she's going to age more quickly. She's going to get more wrinkly. She's young, so right now she has nice skin. But it is going to get wrinkly faster than somebody who doesn't have that thin skin there. So anything she can do now to help build up that collagen or preserve that collagen is going to benefit her in the long run. So we talked about that kind of pink hue underneath her eye, that wouldn't go away. I wanted to start really, really slow with her. And so we were just going to do one syringe. Her cheeks, she had great cheek volume. Like I said, she's young, and so it was really just her tear troughs. So my tear trough technique, I go into the same starting point that I do with my cheek. Now I may have to adjust it just slightly depending on the length of my cannula. Here I like a 25 gauge 1.5 inch cannula. You can use a 2 inch cannula. It just is kind of a lot of length to be messing with, and you don't necessarily need it. So normally my starting point for my cannula is going to be about here. So right at that lateral canthus, so I can reach back and forward. However, if I'm only treating the tear trough and the cheeks are good, I may move it over just a little bit. So that way my actual 1.5 inch cannula can reach all the way. So just measure it beforehand so that way you're able to get to where you need to. Now the actual tear trough is only considered the medial third. So this is the only part that's considered the actual tear trough. Everything else is considered cheek. So keep that in mind when you're doing treatments, that sometimes we look at the whole hollowing and we think, oh my gosh, that's tear trough and we don't want to mess with it. But in reality, this section is all considered cheek. And so when you're doing your treatment, you can absolutely treat that at the same time. So insertion point there, I like to go in with a little bit of lidocaine with epi to numb it all the way down supraperiosteal and back up. When I am doing that, like 15 units, you don't need a whole lot. So that way it's numb from the surface all the way down to the bone. I will go into the port with my cannula and I will go all the way down supraperiosteal. So I pinch up the entire cheek. I will grab the whole cheek, and people I see all the time, they're going like this to do it. Nuh-uh. All the way from the oral commissure to the lateral canthus, pick up that cheek. So it's really cute. And then you're gonna dive all the way down, and then you're going to glide in more of a superior medial position. So you will glide superior medial. Why? Because you have your orbital retaining ligament here, you have your zygomatic cutaneous ligament here. If you're trying to go straight, you are gonna be missing your mark. So you need to be going an upward superior angle. I will start to fill. Now when I'm doing my filling deep, actually in the entire tear trough area, we're gonna do 2 different colors here, but when I'm going deep, I'm doing little struts. So what I mean by that is I'm not just pushing a solid thread. When I think about the lymphatics of this area, I do not want a cohesive product. I do not want elastic product. I do not want a product that is binding together at all. I want a product that scatters. And if you've ever played with Restylane L and actually played with its properties, I think of like table sugar, and it does. It just kind of scatters. Those particles are not cohesive. And that's what I want in this area, because I want those lymphatics to be able to drain through. So little struts, meaning I push, I pause, I pull out a little bit, I push while I'm pulling out. So it's like little tiny struts, and I will work this entire area with those little struts and just tiny pushes. If I'm using 0.5 per side, let's say, which is what I did on her, you can imagine how small each of these little pushes are, right? Then I'm gonna come out and I'm gonna look at it and I'm gonna say, okay, does that look good, or does it need a tiny bit of airbrushing? If it needs the airbrushing, I'm gonna go back in, but this time I'm going to be in the superficial plane. So I try to get where it's not hard to get in there, because if it's hard, you're in muscle, but I don't wanna be so superficial that I can see like the silver of my needle or my cannula, right? So it's trying to find that happy medium. And then I'm gonna do the same thing. I'm gonna be placing the tiniest little struts of superficial. Now, when I'm superficial, I don't do more than 0.1. So tiny, tiny amount. That means in this cheek or in this under eye, I did 0.4 deep and 0.1 superficial. The reason why is because we know that tindling is caused by that light reflecting when the filler is too close to the surface. And the more product I have there and the more superficial it is, the more chance I'm going to have of tindling regardless of the product type. I've heard people say, oh, one product causes it and another one doesn't. It doesn't matter. If it's too close to the surface, you're going to get that tindling. So tiny, tiny amount. There isn't a whole lot pushed there. It's a very, very delicate application there. If she had hollowing here, so this is my insertion point. If she had hollowing on this orbital aspect of her eye, I will do the same thing. So I'm going to back it out, redirect, and then I'm going to head in this direction and place little tiny amounts as I move my cannula around, all in this area. And it's a very, very small amount that I'm adding there. So we did that both sides of her face. It's actually not a technically difficult way to do it. It is more just a very delicate. You have to be very, very careful with your application. Less is more in the tear trough. So I will do this. I will make them wait, even if they need more. You'll see that she needed a little bit more. They are waiting a month, and then we'll reassess and we can do more after that. But I do not do it initially more than that. So different angles, that way you guys can see that hollowing that she had, a little bit of hollowing on this outer, but you can really see that kind of pink coloring as well. So there was her before, there was her after. Again, did I take away the pink? No, it is still there. And like I said, maybe even slightly more apparent. So that's why I always talk to them about that first. But definite improvement as far as the hollowing goes. And then we'll get a different angle here. So she was happy with her results. Like I said, I think she would be able to use a little bit more, but we wanted to go really, really slow. So we did that and we followed up. And then actually we did her lips later. She wanted her lips done the same time, but she had product up underneath. When I flipped her lips over, you could see that curtain in her mucosa. And so we had to dissolve before we could refill. So we dissolved this time before we refilled. So we'll talk about her lips here in a second.